Okay, good afternoon, everybody, and thank you for being here for part 2 of our Healthy Northeast Ohio webinar series. Today's topic that we are going to be discussing is mental health and addiction, and we thank you all for being here. So we are going to dive right in. I know some people are still joining, but given the short time frame, we want to go ahead and get started because we have a lot of great content to cover. My name is Libby McGraw. I am the Community Health Improvement Manager for the Healthy Northeast Ohio program, and I am based at the Center for Health Affairs. And also with me today hosting this webinar is Sarah Zabo. Sarah, do you want to introduce yourself?
Sure. Good afternoon, everyone. My name is Sarah Zabo. I'm a data analyst at the Cuyahoga County Board of Health, and thank you so much for being with us here today.
Thanks, Sarah. If some of you participated in our last session, this format today is going to be very similar. So we are going to kick it off with a high-level website overview and then move into all of the data components on the site related to our topic. And then we will hear from our partners. So I'm very pleased to be joined today by April Vince from the Cuyahoga County Board of Health, and we'll hear from April in a little bit. And then we will round out our session today with some Q&A. So as you're having questions come up for either Sarah, myself, or April, please do feel free to put them in the chat, and you can address them to everyone just so that we make sure that we see it. And a little bit of background, again, some of you I know are familiar with our efforts. We are coming up on our 2-year anniversary in December of the healthyneo.org site, and we continue to use the Conduent HCI platform. We maintain a presence in 8 counties across the Northeast Ohio region, and we are funded by a grant through the HealthComp Foundation and through partner contributions. So again, we're very excited to be able to conduct this work collaboratively between the Cuyahoga County Board of Health and the Center for Health Affairs. In summary, the Healthy Northeast Ohio site has access to over 275 health and quality of life indicators at various geographic levels. So it's a great centralized location for population health data, and we have all sorts of different tools and resources that can help with community health improvement planning in your local counties. So with that being said, we're going to move right into our website portion of today, and I'm going to go ahead and stop sharing my screen, and we are going to hear from Sarah. As we've mentioned, today's topic is mental health and addiction, and this was something that we heard feedback from in a survey that we conducted a couple of months ago, and we also know that mental health and addiction is a reoccurring priority across our region in the community health improvement plans. So that is one of the reasons why we definitely wanted to touch on this topic today. So I'm going to go ahead and turn it over to you, Sarah.
Thanks, Libby. Sorry, I was just waiting for the share the screen option to come up. Okay. All right. Libby, can you confirm that you're seeing the website for me?
Yep, I can see your indicator list by location.
Perfect, thank you. Okay, so today I'm just going to be briefly highlighting some of the mental health and addiction related data that's available on Healthy Northeast Ohio. And then I was also going to just show 2 data related tools that are available to you on the website. So I thought I would start with showing you the indicator list by location. So for those of you that are familiar with the website, bear with me. But if anyone's new to the website, this is a great place to come. If you want to see what kind of data we have available, this list shows every single indicator that's on the site. And as you can see, they are categorized by topic and subtopic. So for example, for today's topic, this health and then alcohol and drug use subtopic might be of interest. And I'll scroll just a little bit so you can kind of see what this page looks like. But again, it's just showing all of the indicators we have available. And then to the right, you're going to see all of these columns as it also shows the geographic levels that that indicator is available at. And as Libby said, we do have more than 275 health and quality of life indicators, and these come from more than 30 sources that include a variety of state, national, and other sources. And most of the data on the website is maintained by our vendor, Conduent HCI, but we can also add local data to the website. So here you can see the geographies that we have available are at the state, county, municipality, zip code, census tract levels mainly. So again, just check out this list, especially if you're a new site user. So next I'm going to show you how to use the search for data website. So here, if you had a particular keyword, a specific indicator, or a location you were interested in, you can do all 3 types of searches here. So I'm just going to go ahead and do a keyword search for alcohol. So then what the website will do is just bring a list of all of the related indicators to your keyword search. So I'm going to go ahead and click on one just to dig a little bit deeper. So I'm going to click on adults who binge drink. Hopefully this loads. There we go. And then you can then select a location. So I'm going to go ahead and select Medina County. Once you've selected your location, you're going to then be taken to the indicator detail page where you can read more about it. So you'll see up top a description of the indicator, some text about why that indicator is important. And then you're over on the left, you're going to see the current value for the location you selected and the source of the data, as well as the measurement period and when it was last updated. And then to the right, the website is going to show you any comparisons that are available. So here we can compare Medina to other counties in the state and across the country, also to just the general US value, as well as the Healthy People 2020 target. And if there were any subgroup data available, those would also be showing here as various graphs that can be downloaded. Maps can be downloaded on the website, as well as the actual data itself by clicking down here at Download County Indicator Data CSV. And then one other little tip I wanted to point out is we do have a See the Legend option on the left if you need any help interpreting any of those gauges and dials on the site. Another thing I wanted to not necessarily show, but just to mention, so in addition to all of the indicators that are available on the website, we also have these 5 specialty dashboards. So if you just go to Explore Data, Specialty Dashboards, you have access to those. We have demographics data, disparities data. We have 2 tools that Conduent created, the Food Insecurity Index and Socio-Needs Index, as well as a Healthy People 2030 Progress Tracker. So the first data-related tool I wanted to show is the option to build a customized dashboard on the website. And to do that, you would go to Explore Data, Build a Customized Dashboard. So here's an example of one that I created around mental health indicators for Summit County. So these dashboards, as you can see, will show the current value for the indicators you've included in your dashboard, as well as, again, those comparisons that are available. And these are really nice because they're dynamic. So as the data is updated on the website, your dashboard also automatically updates. And you can easily share these dashboards if you just click on the Save a Link to this search, and you can copy the URL to send to others. These dashboards can also be viewed in the card or list view just by clicking this icon here under search results. So if you wanted to make your own dashboard, I'll just scroll up. You'll just see you've got various filter options. So you can filter by location, by topics, even by data sources, etc. So you just would select all of the filters that you're interested in and then click search. So again, that's the option to build a customized dashboard. The other data related tool I wanted to mention is the option to create a custom report. So these are nice because you can pull together different components on the website into a downloadable PDF. These are nice to help tell the story of your community. You could create these reports maybe for like a community profile, something highlighting a specific topic area, or even maybe a priority from a CHIP. And I did just want to mention that when you create reports on the website, they are static. If you wanted to create your own custom report on the website, you would go to Tools and Resources and then Build a Custom Report. And you would start by selecting a location. And then as soon as you do that, you have the option to create your report. So you can include as many indicators as you want. You can drag and drop, resize any of the components. And then as I shared, you can download that as a PDF to share with colleagues. So I am going to go ahead and stop sharing because we wanted to leave plenty of time for April. I'll stop sharing. And Libby, if you could pull up April's PowerPoint. So that covers the website demo, and I'm going to go ahead and turn things over to April Vince, who, as Libby said, is also from the Cuyahoga County Board of Health, and she's going to be sharing about the Overdose Data to Action grant efforts in Cuyahoga County, and we're really happy to have you, April.
Thank you. Thank you for having me today. My name is April Vince. I'm a program manager here at the Cuyahoga County Board of Health. And the program that I help to manage is the Overdose Data to Action Cooperative Agreement with the Center for Disease Control. It started 2 years ago at the Board of Health. However, before then, we had efforts that were underway through the Ohio Department of Health. But this specifically is going to highlight our work with addiction specific to opiates, data we've been collecting, and our efforts within the community. My partner in crime here is Becky Karn. She was unable to be here today. And our PI on the project is Vince Carafi. Next slide, please. So we have several partners within the community that we contract with for the work. Case Western, they serve as our evaluation partner, and I'll go into deeper details as we go along within the PowerPoint. We work with the Cuyahoga County Medical Examiner's Office, St. Vincent Charity Medical Center, Thrive, the Cleveland Police Department, which was recently added, the Fusion Center there, Circle Health Services, which now I believe is called the Centers, the Adams Board, Center for Health Affairs, Cleveland State, Metro, and Woodrow. Next slide, please. So this kind of just highlights for you a little bit of what Case Western does. Specifically, it's housed within the Begun Center, and Dan Flannery there is heading up the efforts for OD2A. That's short for Overdose Data Detection. The grant is a $4.4 million grant. That's every year. We're moving into our third year, and they have extended it to a fourth, which we're very grateful for, and hopefully we'll be able to move into 5 and 6 beyond then. Next slide, please. They work specifically with self-care trainings within first responders and our QRT, which is Quick Response Teams evaluation. A QRT, if you're not familiar with that, is usually a police officer, a social worker, and a nurse will go to someone's home who has overdosed and offer them assistance if they are open to it. They also work with our OFR, and OFR is our Overdose Fatality Review Team, and work with timelines, and then they also evaluate our OFR efforts. Next slide, please. And again, this is just more of their efforts there. There's really a lot going on. There's so much and so little time today for me to get into everything, so I'll try to be brief, but we can certainly send the slides out afterwards. Next slide, please. So our Cuyahoga County Medical Examiner's Office, our partnership with them, they really help to give us cases for our overdose fatality review. And there are several partners in the community which comprise the OFR. They put out recommendations. They usually review 3 to 4 cases. Next slide, please. Sorry, I'm talking to the next slide. They review 3 to 4 cases. I think it's every quarter that they meet, maybe every month, and I can get that information for you. But what they do is they do a deep dive into the case and work with partner agencies to see kind of where they might have missed some intervention efforts. And oftentimes, as we're speaking about today, mental health, kind of, you know, where could we have intervened with mental health services for that person as well. Next slide, please. This is just kind of some black and white data that we collect throughout the year. This is part of our strategic plan. Next slide, please. So St. Vincent Charity Medical Hospital Center. Next slide, please. A lot of the work that we do with St. V is they implement the SBIRT, which is a screening tool to assess a person's alcohol use or drug use. And the scale, they're rated on a scale so they can see whether they're at risk and if they are in need of assistance, and they're able to offer them that assistance there at St. V's. And the prevention strategy that they work within is the linkage to care, which is one of our strongest strategies that we have. And I'll go into more detail throughout the presentation as to the other partners that work on this strategy as well. Next slide, please. Some data that we track within St. V's is what their approach is to the SBIRT screening, different agreements that they have within the hospital, any secondary screening that they complete, referrals to treatment, and most importantly, the linkage to treatment. Next slide, please. Thrive Behavioral Health is another partner of ours that we work closely with. Thank you. And they are They are an agency that has 24/7 peer-to-peer support within emergency rooms. And what peer-to-peer support is, is it's someone who has been in recovery, active recovery for 2 years, and typically they have to go through a short training to be certified as a peer-to-peer specialist. They will meet with someone who has presented at the ED with an overdose and is willing and ready to get treatment. They'll talk them through the process, and it's really been a huge success within the emergency departments and getting people to treatment. Next slide, please. Again, this is just some data that we pulled through year 2 that was this year for quarters 1 through 3, kind of who was referred, the success rate, the follow-through rate, and some demographics here. Next slide, please. Again, the referral rate. And we are in the process of putting out a COVID data brief to see how COVID really impacted, if there was any decrease or increase, or if it kind of remained steady as far as referrals to treatment. Next slide, please. Our next partner is Circle Health Services, specifically within Circle Health Services, or the centers. They do offer an outreach service for the Clean Needle Exchange. They're one of the only Clean Needle Exchange services in Northeast Ohio. And we were able to assist them with establishing a mobile unit. Before, they only had 2 brick and mortar, both on the east side and west side. So we are in the process now of really trying to mobilize best efforts for that van and hotspot areas that we have found for high overdose incident rates. Next slide, please. And here's some data we put together again, how many people participated per month, and some demographics around their gender and race as well. Next slide, please. And here we just have the black and white data for how many people who are referred to treatment and referrals to MAT, and MAT is medication assisted treatment. So if you're not familiar with that, if someone is trying to stop the use of opioids, then they will be referred for MAT, which involve anything from Vivitrol to buprenorphine, or I already said Vivitrol. Suboxone is also used within Cuyahoga County, but Vivitrol seems to be the most common one we're seeing at this point. Next slide, please. Oh, and one more thing about Circle Health Services, I just want to add. They also offer naloxone kits on their van and fentanyl testing strips. Sorry, next slide, please. So the Adams board we work closely with, they work on, excuse me, 2 initiatives. And primarily they work with our overdose fatality review. They have an OUD specialist that sits on the review board and dives into the cases again to try to find what was missed, where could we have intervened earlier in the person's life to prevent this from happening. And then what this OUD specialist will do is, after a while, they will reach out to the family and get permission to do a one-on-one interview with the loved one. Before COVID, it was supposed to happen in person. Now it's done over the phone, which is a little less personal, but they've still had really great success with kind of getting a narrative and the story behind the person, and ways that we can improve some resources and services for people in the future. And then another thing that they help us with within the community is they do training sessions with police officers. Specifically right now, they're just doing the training for suburban precincts, and it's called their CIT training, so crisis intervention training. And what that training encompasses is everything from trauma-informed care, training on ACEs, what ACEs means, and how that they can respond to something, you know, if they run into in the home, even if they're going for a domestic violence situation and something else is found, how can they respond in a trauma-informed way with compassion and help that person get access to resources if they found someone in the home that has a substance use disorder. Next slide, please. and Center for Health Affairs. We work closely there with a program manager that has worked in coordination with Metro Health and created this academic detailing toolkit. And academic detailing, if you're not familiar with that, what it is, it's based off of kind of like what pharmacists used to do with doctors and would train them on how to utilize a drug. Well, this is pharmacists or other doctors going to doctors and saying, hey, do you have any patients that are on opioids? Do you need some help in how to prescribe, how to manage prescribing, or anything of that nature? So it's really one-on-one. I think there's 93 physicians that have been trained within Metro Health, and we're hoping to expand that into other hospital systems within year 3 and 4. Next slide. Oh, sorry. If you could just go back to the next one real quick. So this just goes into detail about the toolkit itself, and I can send out a link to that platform. It's really great. It's not just open to Cuyahoga County. It's open to anyone that is interested, has access, you know, outside of the state of Ohio even. So it's a really great resource, not just for providers, but also for nurses and nurse practitioners as well. Okay, next slide. And Cleveland State University, we work really closely with them. They have a site called drughelp.care. It's a platform where individuals can access the site and see a live report from providers and agencies that have registered on the site. And they do, as you can see, they have a large amount of providers. It's really user friendly, and you can narrow it down to, you know, what kind of insurance you have, or you're a single mom and need childcare during your stay. It's really detailed, and our funds have helped to further the evolution of the site, and they've been a great partner to work with, and we're hopefully we can expand it throughout the state of Ohio. Right now, they only focus on Cuyahoga providers, but they are expanding that. Next slide, please. Oh, okay. That's just more data. That's okay. You can go to the next one. Okay, so this is just interesting as far as, so we did a media campaign back in, I guess it was June 2021, but this just shows kind of like their usage over time. So they're able to use their Google Analytics to see who's visiting their site from where, and you know what's really impacting the use. And our media campaign, I think we would direct them to drughelp.care to increase slightly. So we're still trying to figure out what's the best avenue to really get the word out to everyone about the services that they have. Next slide, please. This is just a handy dandy infographic that Case created around drughelp.care that highlights some data if you're interested in that. Next slide, please. Metro Health, again, I mentioned them earlier. They do a lot of work. I'll try to be brief again. They work with academic detailing partners. They work a lot with our PDMP program, and that's, you know, teaching prescribers how to prescribe. They have a mobile van as well, giving out Project Dawn kits and also fentanyl testing strips. We do track how many kits are given out, and then there's self-reporting as to how many were used. It's hard to tell how many were used, but we do the best we can with the data that we can collect. Next slide, please. This is just the different strategies that they work in. Well, they also have a program within the correctional facilities. So they're one of the only hospital systems to go into the correctional facilities and work with people that have OUD and offer them MAT. And then they have follow-up with those individuals 3, 6, and 9 months after. And it is free to the person, the MAT. So it's a great model actually for other hospitals and correctional facilities within the nation. Next slide, please. Our last partner that I'm going to highlight is Woodrow. They're another agency that we work with that does peer-to-peer work within the emergency departments. And again, it's 24/7. They are not physically housed within the hospitals right now. and they're mostly in the Cleveland Clinic emergency departments. They had to switch to face-to-face iPad time, but they found that it was just as successful, if not more, because they were able to have a quicker response time. And you can just see here from reading some of the bullets that they had a 96% success rate, which was great. Next slide, please. And again, this is just an infographic that was created from the Begun Center highlighting the Woodrow Project. And you can find all of our data briefs and these infographics on ccbh.net. It's on our overdose data dashboard. You kind of have to dig a little bit, but if you go to the A to Z index and click on O, it'll take you down to the overdose page, and you can scroll through and look at the data dashboards. And I think I'm out of time. Sorry.
Thank you, April. No, that was great. That was just, we just hit our time to make sure that we can respond to questions. So thank you so much. That was, oh my gosh, it's so exciting to hear about your program. And for our last part of the series, when we had Lorain County Public Health, I find it amazing. I mean, of course, we know all the work that our partner is doing is so impactful, but you guys, nobody's sitting around. Everybody's very busy doing this important work, which is really great. So we thank you for that. And I'm going to go ahead and pull up our last couple of slides on my end, and I want to make sure that we leave about a minute for questions. So really quickly before we get to that, here is the contact information for Sarah and myself, and you can also contact us through the website. And we do have part 3 of this series and the final part coming up on December 14th. So if you have not signed up and are interested, please join us for that. And we will also be conducting an Ashland County webinar next Tuesday, November 9th. So with that being said, I'm going to look at Sarah to perhaps look in the chat for any questions. And while she's looking, April, you answered one of my questions. I was going to ask where the data briefs are. And so thank you for sharing where people can find those. Sarah, anything that you're seeing come through in the chat?
April, thank you so much. I put in the link to the overdose data dashboard. You can double check, but I think that's the right
Thank
link.
you.
It looks like we had a comment just saying thank you for all of this information, April. And then there's someone else chimed in. Thank you for the information. Are any of your EDs providing Project Dawn kits to those that have recently overdosed?
So anecdotally speaking, it's hit or miss, dependent on the hospital system, and I could certainly get back to you with specific answers on that.
Great, thank you. And we have about a
Thanks,
minute left,
April.
and I do just, oh, Sarah, sorry, was there anything else? I didn't mean to.
No, I was just going
cut
to
you
say
off.
thanks, April. And I'm not seeing any other questions. If anyone has any other questions, like Libby said, we have like another minute or so, so feel free to add those to the chat.
Yes. And I was just going to add one more comment or question for you, April. Any lessons learned or best practices for other counties who are perhaps on the call today, who are also working in this space? Or if you had one golden piece of advice to any of our partners who are working on this topic, kind of what would your response be? I know that's a loaded question.
There's so many things going through my head. Honestly, the thing that's brought us the most success so far is, and I know it's cliche, but partnerships. Having strong partnerships that are willing to share without being territorial is key. So partnerships are really important. And also I would say, take a look at the work we've done for our overdose fatality review. They've really kind of been a model also across the nation as far as the work that they've done. So.
That's great. Thank you. And as I was asking that, I knew in my head, I thought it's still seeing all of this information about all the partners that you all work with, and that collaborative nature is so important for this work and with so much of the work in this space of community health. So we appreciate that feedback, and we thank you again. And it looks like we are just at about time. So thank you all for joining us today. We hope to see you for part 3, and we hope you have a great afternoon. Thank you, everybody.